Good afternoon, ladies and gentlemen. My name is Moisuga Boaz, hail from Uganda. So, the topic is South African governments should provide free genetic counseling services to support informed decisions and genetic testing. So, we shall be discussing in the affirmative. So we see that genetic counseling is a process where individuals or families receive guidance about medical, psychological, and familial implications of the genetic contributions to diseases. We see that the rise of genetic diseases increases the availability of genetic testing, and also there is potential for misuse of genetic data, and also access to counseling services, which is crucial to ensure informed and ethical decision. In our opening statement, we say that our position is that African governments should prioritize providing free genetic counseling services as an essential component of public health, and this is to ensure equity and also to promote informed decisions regarding genetic testing. So the argument here is that if these services are provided free, there will be equity in health. We see that free health services are able to ensure accountability for all, regardless of the different socioeconomic statuses. So it will ensure ethical responsibility. We see that the informed decisions are able to reduce the risk of misuse or misunderstanding of genetic information. So it has a benefit economically. We see that if you have preventative strategies, then they will informed by genetic counseling can reduce the long-term costs of health care. So the constructive argument here is that like I said, there is improved public health outcomes. We see that genetic counseling can identify hereditary risk factors like sickle cell anemia, cancers, and rare genetic disorders. So early detection and intervention can save lives and reduce the burden on healthcare systems. Two, equity in healthcare. We see that many Africans cannot afford private genetic counseling, so free services ensure that all individuals, regardless of their income, can access critical information. This will prevent widening health disparities caused by unequal access to advanced prevention of the misuse of psychological stress. We see that without proper counseling, genetic testing can lead to misinterpretation of results, causing unnecessary anxiety and also decisions based on incomplete understanding. So, cost effectiveness, we see that genetic counseling informs preventative care strategies, and this reduces on healthcare costs with managing advanced stage diseases. It will also avoid wastage of resources on inappropriate genetic tests. We see that opposing argument here is that free medical services may strain limited resources. Now the response to this is the long-term savings from preventative care and reduced disease burden outweigh initial investments. So external partnerships and donor support can offset healthcare costs. So the argument is that the demand for services may be low due to limited awareness. We see that free services can be paired with educational campaigns to raise awareness about the important and the benefits of genetic research. So the summary of the arguments, we see that free genetic counseling services can promote health equity, ethical practices, cost-effective healthcare strategies. We see that these services are essential for addressing the rising burden of genetic diseases in Africa, ensuring that all individuals have the opportunity to make informed health decisions. So the final reinforcement to this, we see that if we invest in free genetic counseling, it is not merely a health initiative, but a commitment to building more equitable and informed society. So the African governments must take proactive steps to integrate the services in their. Thank you so much. Any questions?